Yeah. Mr. Quaid is going to be a bit late for the meeting. He's going to for the construction meeting. He said he'll join us a bit later. I guess we can start the meeting. And you can take a minute to go through the September minutes that have been provided. And is there a motion to approve? You second it? Is there a motion to oppose? Alright, I guess we all are in favor. And Paul, can you?
Can we start? You want to go around and do introductions real quick?
Yeah, that's a good idea. So let's do a round of introductions and the organization we all represent. Starting from me, my name is Arvinder Singh. I'm the chip coordinator at Lakeview District.
I'm Christy Albertson. I also work here in the health district. I'm the grant writer.
I'm Diane Clay, and I'm with the Hospital Auxiliary and Food Share Program.
Taylor Headstone, Beth Hadley, Public Health,
Susie Montgomery, Auxiliary.
Michelle Hanson, Food Corps,
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Alana Shamulak. I'm with the Eastern Oregon Healthy Living Alliance, and I'm the school-based oral health program coordinator.
Darwin Johnson, planning director for the county, also on the town council. Jimmy Hall, examiner.
Ken Kessner, county commissioner, and also on the board of EOCCO.
Noni Moss, senior navigator at the Senior Center. Andrea Wishart with the Senior Center. Shereen Morgan with Food Gardens and the board of directors at the Senior Center.
Well, thank you everyone. And Paul, do you want to start?
Sure. We can just go back one slide. Can you go forward when I ask you?
Yeah.
Okay, great. Our vendor will send you a copy of this presentation. There's one handout that's been printed for you because it's kind of hard to see on the screen, and you should keep it handy. But what we're doing here today is what we call a primer, or a basic Coordinated Care Organizations 101. This is your opportunity to get the basics of how this works. The Regional Community Advisory Council had requested that whenever this is presented to a local community advisory council, the member of the board of the Eastern Oregon Coordinated Care Organization be present. Ken is here today to help answer any questions about how or why we're doing things. But now's your real chance to ask basic questions to see how things are going to work in the future for the next year for the Lake Community Advisory Council, as well as your Community Health Improvement Partnership. So next slide, please. So what we want to do is cover and understand Medicaid, what it is, what it doesn't cover, who's included here, and the issue of your being a community advisory council and the EOCCO dealing strictly with the quarter of the people who are members of Medicaid in Lake County. We want to talk, go ahead.
Do we have a minute taker?
We do have, we want to cover what coordinated care organizations are and provide you a little bit more about the Eastern Oregon Coordinated Care Organization. Share these things that we call incentive measures and what they mean to you and the resources that it can bring. We'll cover the Eastern Oregon CCO, how the money flows into the CCO, what we do with it and how it's redistributed and reinvested back into communities through what we're calling now Community Benefit Initiative Reinvestments. But let me just say this. Organizations that are nonprofit by their design are supposed to provide a substantial community benefit. And that's a term that the Internal Revenue Service has that allows tax-exempt organizations to be tax-exempt. And since we are a limited liability corporation, the EOCCO, we also feel a need for that. And so where dollars are reinvested back in communities, we're changing the terminology from transformation grants or LCAC funds to Community Benefit Initiative Reinvestments. So that's where you'll hear that term. Next slide, please. So Medicaid, who does Medicaid cover? Anybody? You're guessing, you're gonna be right.
Yeah,
Low income people, right?
yep.
Okay.
Medicaid, yes.
Who does Medicare cover?
Yeah.
Anybody over 65, blind and disabled? Okay? Medicare has nothing to do with the coordinated care organizations. We are exclusively about Medicaid. Medicaid is a partnership between the federal government and states. States provide general fund dollars, so that's the money that you see when you look at the bottom of your check and get all mad. But it says state of Oregon, you know, and then there's dollars that are distributed there. We use those general fund dollars to match federal resources to run the program. It's run at the state by an organization that you'll hear called the Oregon Health Authority. And the Health Authority is the one that asks the federal government to allow Oregon to do things differently through a waiver. Okay, so this waiver has been a hallmark of Oregon's Medicaid program since prior to Governor Kitzhaber's first sets of terms. We've always asked the federal government, let us do something different with the program. Right now, we have a waiver request into the Centers for Medicare and Medicaid Services at CMS that is pretty aggressive. It will be good for 5 years. We are hoping to hear from them before November 8th. So that if there's any kind of change in administration, this is already agreed to by the federal government that that's what we want to be doing for the next 5 years. It would continue coordinated care organizations for 2 reasons mainly. First of all, the last waiver that allowed us to create coordinated care organizations, Oregon made a promise to the federal government as a state. We said, if everybody else's Medicaid costs raise at 5.5%, we'll make sure that Oregon's raise each year only at 3.5%. And if we didn't meet that goal, collectively, all of us Oregonians, through our general fund, would have had to pay back these fines that we had established. Several $1 million, hundreds of millions. So we've been successful over the last 5 years. This notion that when you hear the AAA, lower costs, better care, lower costs is not what's happening. We're slowing the growth. That exponential growth curve is what everybody's worried about. It's not that the program is actually lowering costs, it's slowing the growth curve. So we're looking forward to that news on the waiver, hopefully in this month, that will allow us to continue to work through these next 5 years. There's a couple of things in the waiver that are of note, particularly for our board of directors. 2 things in particular. One is housing, and we've talked about that. You saw last month, Dan Schwann's talked about a small program for severe and persistent mental illness, a rental assistance program. We're not sure how it's going to play out, but the CCOs are going to have some responsibility for helping in terms of housing for our members. We don't know what it's going to be, but that's a big risk. Once we enter into that area, and we've already got responsibility for transportation, which you heard about, non-emergency medical transportation. The other piece of the social determinants of health, Rachel, is
Like food?
exactly food insecurity. You know, we'll be working with, you know, the Oregon Food Bank has already approached us about some promises that they can keep to help there. But when we start working on the social determinants of health, that's really where the difference is going to be, I think, overall. If we can get people in house, that's when we can start to lower costs. Lower them, not slow the growth. Anyway, again, remember, you know, for the Eastern Oregon Coordinated Care Organization, we're dealing with Medicaid recipients. You guys are concerned overall about broad community health. One of your priority issue areas for your community health improvement plan is senior citizen activities. Doesn't mean you can't keep doing it. We want you to keep doing it. It's just that the money that comes from the EOCCO can't be used for non-Medicaid recipients. There's some residual fallout if you put a billboard up and it says kids should be screened between the ages of 0 and 36 months for developmental screens. Everybody sees that, right?
Yeah.
Well, you know, that's how we, you know, in terms of the messaging that we can do that can benefit all. And clearly, Juanita's not here today. You know, the clinic is going to be interested in working on the incentive measures, and they're not going to just do something at a clinic for the Medicaid population. They're going to do it for everybody that walks in. If they start doing screening and brief intervention and referral to treatment for patients, you know, which is drug and alcohol use, they're going to do it on everybody, regardless of the payer source, once those systems of care are in place. So the benefits can be far-reaching, even though we're using Medicaid dollars to start.
Hey, Paul,
Yes, questions are welcome here. This is your chance to do it.
the housing component of the waiver, is that just for mentally ill members, or is that for anyone?
No, it's pretty ill-defined.
Okay.
And there's also another piece too that says that we need to do, and I told them, please change the name of this, but it's written in there, it says community health partnerships. How many of those do we have? Anyway, we're supposed to form these things to help people who are in the state hospital return back to their communities, mental hospital, and have housing supports for them as well as the coordination of the care for physical, dental, and mental health for those populations. That's about all we know right now. So it'll be promulgated in rules from the Oregon Health Authority to the CCO as we move forward. Next slide. So what is a coordinated care organization? It's a network of all types of providers who work together in their local community. So it's Mindy and Mindy Binder and the Advantage Dental Program. It's Moda Health for the physical health, and it's Greater Oregon Behavioral Health for the mental health component. In your community, all of the providers accept Medicaid recipients, so nobody's excluded there. Hello, welcome, no problem. So we're supposed to financially integrate those things. And how do we do this achieving of coordination? Well, there's one big way that we do it, and that's through patient-centered primary care homes. And it was only 2 months ago, I believe, at our meeting that Juanita announced that the clinic here had attested and sent to the state that they are a patient-centered primary care home. Warner Mountain has been in the process. The North Lake Clinic has been a patient-centered primary care home for a couple of years. What do these patient-centered primary care homes do differently? Well, they better coordinate care. They provide 24/7 phone access for the population that they're serving. And again, that's everybody that's a member of that clinic. They're not just going to say, only Medicaid recipients can call and get help 24/7. It's anybody who calls up. They're going to try to integrate behavioral and mental health into the primary care setting, particularly as that helps reduce stigma from having to go somewhere else when you've been diagnosed with mental health illness. This can be particularly advantageous for Lake County now that the health district is operating both primary care and, as Charlie told us a meeting or so ago, the mental health component is together. Makes it all that much better in terms of being able to coordinate. These patient-centered primary care homes deliver a number of services that we are supposed to be able to deliver as a coordinated care organization. And next slide, they're called incentive measures. Okay, what are these incentive measures? Let's say Ken is the president and Alana is vice president of Lake Health Insurance Company. All right, and the rest of you guys are the board of directors. Ken and Alana and the actuaries send out premium notices to all of the employers. They send it to the schools, the county, the city, Collins, the wood factory. I mean, everybody gets these premiums, right? And then we send them all to Ken and Alana to hold, right? And then they wait and see how people use healthcare services, and they pay bills out of those premiums, right? The less people that use those services, are we happier as an insurance company? Yes, we are. You know, if we're a for-profit insurance company, we want to be able to keep, the less people use, the more profits we make, right? So the Oregon Health Authority says, coordinated care organizations, we don't like that model. You're going to be like an insurance company, but we want you to behave differently. And so what they say is, we're going to give you money to take care of the Medicaid population and pay the bills, but we're also going to withhold a percentage of that money, and you can earn it back by providing these services. If you provide these services and meet 13 of the 17, you'll get the dollars back. For 2015, they held back $10.2 million from the Eastern Oregon Coordinated Care Organization. We're already in the middle of October for 2016, and they're holding back about $15.4 million. In 2017, it'll be about $20 million, and it'll be capped out at that. So if you look closely at these incentive measures, and you say, there's nothing in here about getting sick and being treated for an illness. Isn't that curious? That's expected. We're going to have people get sick and appendices burst and people getting, farm accidents or crashes of some sort. They're going to get fixed. But if you look at these items, they're all about early detection, prevention, and screening. That's what they're measuring us on. Reaching out to our population to find things early. Again, the belief is that if we can do these things, we're going to catch things quicker. We'll be able to not have those expenses later on in the process. So we have screening for alcohol and drug misuse that happens at primary care. We have emergency department visits. We're trying to eliminate the inappropriate use of the emergency department. How do we do that? By providing 24/7 phone access through patient-centered primary care homes. Do I really need to go to the ER? Can I get an appointment tomorrow? Developmental screening for kids 0 to 36 months. If we can catch these kids early, we can help them through early childhood activities, right? Get them ready for kindergarten. That's our goal through the early learning hubs that you'll see that we're required to work with. If somebody's been in a hospital for a mental illness, they need to be seen within a week of being discharged. We have a kid that's placed in Department of Human Services custody. So they're in the foster care program. As soon as they're placed within 60 days, they must have a physical, oral, and mental health visit to make sure that that kid has a chance. Effective contraceptive use, number 6. It's one key question. I don't know if you guys have trained in that, Beth, have you? Okay, so one key question is, anybody that's between the ages of 14 and 44 that's female, during a visit, somebody's going to say, would you like or intend to become pregnant this year? If the answer is no, that opens up the conversation about what you're doing to prevent that pregnancy. If the answer is yes, then we start the prenatal vitamins and get them ready for the actual timeliness of prenatal care as part of the process for a healthy baby outcome. Those 7 and 8 are surveys of our members and their attitudes and beliefs. Number 9 is dental sealants. Advantage has done a pretty good job on that. Number 10 is the number of patients in our system that are enrolled or assigned to a patient-centered primary care home. We're supposed to have 100% by 2019. Whether that happens or not, I don't know. But we're well into the 80% now. There's a person along with Jill Boyd and myself who worked with Juanita to help them work through the things to become a patient-centered primary care home. And we've helped other clinics across the region as well. So we're dedicated to that. Colorectal cancer screening is another one. We can prevent that cancer if we get to it early. Timeliness of prenatal care. Another challenge for us, that for an incentive measure that we did not meet, was the adolescent well visits. These are visits for teens. The barriers seem to be twofold. Number one, it's community attitude about looking for services when you're not sick. The other one is what happens during that well visit that we've had some pushback on. Now, our local community advisory council in Baker, their clinicians in that community a couple months ago decided they weren't going to do sports physicals anymore. They had always lined kids up and chart check and signed the forms and let them go. You know, they said, no, we're going to do station to station and do an adolescent well visit on them. And this adolescent well visit talks to them about their mental health, talks to them about sexuality, talks to them about risky behaviors, all these things that we can try to make an intervention on early. They had 141 kids that wanted to play sports, and they went through this thing, and 11 of them had an immediate referral for mental health. And that's just a basic two-question screen. You know, so if we're talking about keeping kids healthy in mind, body, and spirit, a comprehensive adolescent well visit is necessary. Depression screening and follow-up plan are for all of our members. Controlling high blood pressure and diabetes. Once you've got those diseases, we can control them as a chronic illness. We've got 2 new ones for this year. One is childhood immunizations, and I'm proud to report that our public health departments around Eastern Oregon do pretty damn good compared to the rest of the state. Now, I'd love to know the reason why there's less resistance to, you know, immunization of 2-year-olds than there is in the valley. I suspect it might have to do a little bit with understanding how we keep our animals healthy too. You know, but anyway, that's good. And cigarette smoking prevalence. We're not required right now to try to get people to quit. That's probably going to be in 2017, but right now it's to determine how many of our members use cigarettes. It's not all tobaccos. And I've gotten some pushback from our local CACs that that's not necessarily where the risk is in our community. It's on smokeless tobacco. That's where the issue is. So all of these are important. If you remember, probably February or so, I brought the cost and utilization report for Lake County here. What percentage of EOCCO plan members across our region use 0 services in a given year? spend no money out of the money that we get from them?
20%.
25. It's 24.7 or something like that. How many of them spend less than $500? What percentage? Another 32%.
Oh, well.
So if you add those together, you know, we have a large percentage of the population that does not consume a lot of services. But the problem for us is if we're going to meet these incentive measures, they've got to show up, right? How do I provide an adolescent well visit to somebody who hasn't been into the doctor at all? How do we get, you know, somebody to go for a colon cancer screening if they haven't been in as a 50-year-old? So part of our community challenge is making sure it's all right for people to seek services. So these are what we're getting measured on right now, and this is worth about 15.6 million, I think, is what's being withheld from our budget currently. Next slide.
Do you know for 2017 what might be coming down the pipe? Is it going to be that plus things or?
Well, some may drop off. They come and go depending on how well all the CCOs make it. In the first round, elective delivery, so basically a planned C-section was one of them, and it's just not happening anymore. You know, it's not an acceptable part of what the medical community is going to allow. So it went away because everybody met the measure and jumped it. Now, and I've said this several times, each year they set a benchmark for us to reach, and then they hold back more money and raise the bar. Hold back more money and raise the bar. And at the end of this, I'll do a brief status report on where Lake is on this. So basically we have 22%, about 1 in 4 in Lake County that's a member of the EOCCO. These are our 12 counties that I work in. We've got about 200,000 people. And the geographic area is about the size of, it's a little bit bigger than all of the state of New York. And so we've got challenges, but we have systems in place to help deal with that. Next slide. This is the one that you have in front of you. During a prior primer, we had several slides. Jill made this one. It puts it all in perspective on how this all works. So at the top of it, you have the Center for Medicare and Medicaid Services, the feds allowing us to do this thing. They work through the Oregon Health Authority, OHA, that runs the Medicaid program. They work with 16 coordinated care organizations. Ours in the purple is the EOCCO. It is a limited liability corporation. There are owners of the CCO. They bought into it initially. Several of our smaller hospitals, initially Harney, Lake, Grant, Wallowa, did not choose to enter into the at-risk model. Now, these organizations that are up here, these hospitals and organizations are at risk. If we spend more money than the state gives us, this is where it has to get paid from. But at the same time, if we are successful, like all other owners, they're eligible to take a dividend and return money back on their investment. This occurred about 4 months ago. They had 20 million in reserves, and they voted to distribute it based on the percentage of ownership. The board of directors is listed here. Ken's your representative from Lake County. Most counties have a representative. Charlie attends most all of the meetings too, as part of that grouping of smaller hospitals which gets to elect or appoint someone to be on the board that represents their interests. In this case, it's Larry Davey from Wallowa Memorial. Okay, so I mean, if the smaller hospitals have concerns about what's going on, they've got representation there. Not that the other hospitals are big in Pendleton or, you know, they're not regional medical centers at all. We still have a lot of our services that are delivered outside of EOCCO. They're delivered in Boise, in Bend, and up in the Tri-Cities in Washington, as well as people get sent to Portland. We don't have any tertiary facilities in Eastern Oregon. So we have that board. There's a plan that we submit on how we're going to transform things. It includes 8 areas. You guys aren't a part of most of the areas except for area number 4, which requires us to have local input on what we're doing. So we have 12 local community advisory councils as part of the effort. They send a representative and a commissioner to serve on the regional community advisory council. So in this case, it's Charlie as the chair here, and Ken, who are assigned to the regional community advisory council. Technically, their job is to oversee and make sure that each of the 12 local community advisory council is staying in line with what the transformation plan says that we're supposed to be doing. But they also serve, in my mind, as a vetting organization. Before we bring things to you guys, we share it with them and say, is this something that would resonate well with your local community advisory council? Yes, no, maybe. So they see things like on trauma-informed care. I don't believe either of you guys made it to allow, which I didn't expect that we would have great attendance in Enterprise, but you know, we talked a lot about trauma-informed care. How many people have heard this term? Just a few. Well, it's something that we need to be cognizant of, create systems around that. And when we say trauma, we're talking about adverse childhood events, things that are done to little ones that affect their long-term health outcomes, and how we can deal with that in ways that people deal with their health behaviors. And we have the local community advisory councils, and all of you have your own individual community health improvement plans, which we approved and submitted in June. Over on the left, we have a clinical advisory panel. There are no Lake County representatives on that group. We try to make sure we have an OBGYN, a psychiatrist, internal medicine, family physician, a PA, did I say psychiatrist? We got one of them. We got a mental health professional, we have public health on there. So we use them as a sounding board. We say, if we were going to pay for X, Y, or Z, how would it go over among clinicians? Are we giving you enough to help you meet the incentive measures? What can we do to improve, our performance on incentive measures that we're not meeting? So they are advisory. They meet every other month. I also attend those meetings. Over on the left, we have the early learning hubs. It's Douglas, Lake, and Klamath.
Douglas, Lake, and Klamath.
Is the early learning hub. Again, this is one of those things in the waiver that was pretty ill-defined, but it says we're supposed to work with them. So we've had the early learning hub executives at our regional community advisory council meetings. Several of our local community advisory council have joint meetings with the early learning hub boards where they talk about cradle to career activities. It's just, we document it and in June say, hey, we're doing what we can, but until there's money on both sides, there's little. But we do share several incentives. They want kids to be assigned to a patient-centered primary care home. They also want those developmental streams, and they're held to those standards along with us. Over on the right, when I introduce myself, I say Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization. Nobody carries a business card that says EOCCO. Nobody. There are no employees. You are either a Greater Oregon Behavioral Health employee or a MODA Health employee. And I'm having this slide adjusted because we need to recognize Mindy and Marianne and the folks at Advantage Dental for your community, or Capital or ODS. They're part of it as well. Okay, so that's how the supportive staff. Gobi basically does the stuff out in the communities. MODA does all the data and analytics. And Advantage does hands-on stuff all through your schools. in partnership with Alana and the Eastern Oregon Healthy Living Alliance, which is John Adams is the executive director. It is a nonprofit organization that was created to raise money so that you guys could do things beyond that Medicaid population. Questions on how it's organized or who's who? Next slide, please, over here. So again, we have this money that comes to us. It's called the global budget. We're supposed to have flexibility about how we spend it. This is where you heard the story from the governor about buying an air conditioner, right? Because if we could buy an air conditioner for somebody with congestive heart failure and keep them cool during a hot streak and they don't get hospitalized, for $200 we just save $40,000.
Yeah.
Doing things differently. It's hard though for a board to think about what types of those investments across a region are going to be making sense. So it's not an easy task, but we do get to do things differently. But you got to remember, Moda Health, Gobi, we were and are at first traditional insurers. So we have to change our culture in order to think about our investment, and we have been doing so, but it takes a little longer to do. There's a quality pool. That's the incentive measures and the holdback of funds. And what we do with those dollars when we get the dollars back is what we want to go to next. So in 2015, go ahead to the next slide. In 2015, we got 10.2 million back. We missed a couple of incentive measures. We missed the adolescent well visit. Guess how many colon cancer screenings we missed by across the region? 10. If we'd have had 10 more, we'd have met that measure. I mean, so these numbers are important in terms of, having everybody across the region doing these things. At the last board meeting, the EOCCO board voted to redistribute some of those funds, that 10.2 million. What they decided to do, and I'm going to come over here, about half of it, $5 million, is held in reserve. Why was that held? Well, we approved a bunch of things that we want to invest in, but our actuaries at MODA told us that in September of 2017, our expenditures were going to cross over our revenues. And until we got the rate, the premium rate from the Oregon Health Authority, we had to be cautious about the resources. Since then, we got a favorable rate. So at the next board meeting, I'm guessing, which I believe is November 17th, or something like that, they'll probably look to approve different funding in there.
By rate, you mean the capitation?
The capitation rate that we get for each of the patients. We were seeing about a 9% loss and projecting 3.4% increase, but the Oregon Health Authority gave us the full rate increase. So this money will be reinvested in a number of different programs. $3 million of it was redistributed back to our patient-centered primary care homes for helping us meet the measures. So that's the clinics that did that. There are some clinics that are patient-centered primary care homes that are not meeting the measures. And our board has struggled with how to reward those that do. But right now, it's still pretty much an even distribution based on how many patients you have assigned to. But it will get more specific. We have to reward the people who are doing better. And then we have $750,000, so that's what one measure is worth. We met the dental sealant measure. Did Gobi or Moda Health have anything to do with that? No, it was Advantage. They met the measure, so our board, which I deeply respect because other CCOs haven't done this, said this $750,000 should go to Advantage. What they do with it is up to them. But I truly respected that because they're not on our board either. It was a good thing that they did. But they also took about $1.5 million and made it available to y'all in two pots of dollars. $1 million in transformation community benefit initiative reinvestments. This was what you guys called the transformation grant. So this will be a competitive process where organizations can describe things that help meet the triple aim or work through to get an incentive measure approved. And it'll be reviewed by the Oregon Health Sciences University and scored, and the board will look at their recommendations and approve that $1 million in expenditures. If you have a successful initiative, you had, Charlie, help me, one small one was funded with Mira. I think it was the kids one.
Yeah, that's 20,
You know,
or
Yeah, it was about
20,000.
Right, so if that one were successful, you're allowed to reinvest, to reapply for that. These grants look for partnerships in the community. The more people involved, the better off it is. And then LCAT, that's you, community benefit reinvestments at $593,000. So one more slide. I covered that, and again, you'll each get that. One of the things that you should know that of this total that goes to the CACs, the board of directors said, look, Wheeler County and Umatilla County aren't the same. You know, they're just not. But we want everybody to have a base. So they said divide up $373,000 evenly and then distribute the rest of the money based on how many plan members are in that county. So the next slide will tell you what you all need to start thinking about investing. Go ahead.
So who in the county gets that money, that 19,000 base?
Well, it's actually going to be $32,000 for you. And it's up to this LCAC. You guys approved one for about $23,000 last year. But again, if they hold back more money, the board will recognize that the CACs are doing their part and give you a greater percentage back. So this year, unofficially, it says up there projected. I think we're pretty solid. You guys are going to be able to make a plan to spend $32,699. But it must address things that are done to do something about those 17 incentive measures. Make sense?
Yep.
So it's a reinvestment back for people helping meet the goals. So the other PDF that was separate there, if you could bring that up, we'll just talk about where we are right now. Charlie, please, questions are welcome on any of this.
A question was asked, where does the money actually go for the
Oh, yeah.
The check
Whoever the designated group, go ahead.
the check comes to Lake County, Lake Health District, and then we disperse it as the LCAC describes.
And again, that plan is kind of reviewed by OHSU to make sure that, you know, what you're proposing actually targets some of those incentives. It's not that one, it's this one right here. Okay, so in front of you, you also have this slide. It was created by Jill Boyd at our, there should be a paper copy for y'all. This was created by Jill. When we presented where we were on progress before, people would just keep looking and go, man, we're doing awful. And we'd say, no. You know, you can only improve on the number of people who are being screened as we move through the year for certain services. You know, now that we have some experience, though, we can look and see, where were you last year at this time? And so what we have is a box. If it's red, then you're less than 50% from the target. Yellow, you're at least 50% of the target. Green, you've already met the target. Across the bottom is what we have to get as a goal. These are our benchmarks. These are the things that keep rising each year. And then these little arrows are really helpful. They tell you whether you have less at this time last year or going up. So the concern is that we got like, let's say Harney, you know, in dental sealants for kids, they've actually improved. So the arrow's going up from where they were last year, but they're not even halfway there to getting there. So the concern should be around the arrow for you all, and then what color it is. So let's just take a look at it. We're not doing experts aggressively. We're at 1.6%. Our goal is 12.8%, but you're doing better than you were last year. Dental sealants, I'm sure we're going to meet this measure. As Advantage and Alana and those folks do stuff in the schools, Harney will do so as well. You guys just finished every school there, right?
Yeah.
And I think there's like 190 kids that are due for sealants, and they're going to get them, and it's going to be a good thing. For our effective contraceptive use, we're at 16.5% currently, but it's less than it was before. Timeliness of prenatal care, we're well on our way. Emergency department utilization, doing good. Remember, lower is better here. We want less emergency room department use. Colon cancer screening, we're up, but we're still below half of what we need at 15.7%. Developmental screens, public health, you guys are doing work in coordination with primary care, correct, Beth? That's made a bump in that. We saw a jump on one data set real quick.
Yeah, we haven't started that program yet, so I'm interested to know what's going on, because we haven't started.
I don't believe primary care is at the table right now. Charlie, can you help at all? Why you think we're doing better on the developmental screens?
Because we're asking the question more aggressively.
Okay.
We weren't asking as good or documenting.
We're doing well. We're still there. And then on the adolescent well visits, so another one that we didn't meet regionally, we're not meeting here. Adolescent well visits and colorectal cancer screening are some. Now that doesn't mean that you only need to pick those ones in red to use your investment dollars.
Yeah.
Remember, the bar is going to go up, so enhancing some things that you do well is just fine as well, particularly if you have partners in place. Again, this is only through August. September, October, November, December. We have 4 more months of data. You'll be trying to affect the 2017 measures with what your dollars are going to be used for. Make sense? Charlie, please.
When you say through August, is that August claims, or is that August, that means that the
No,
verified?
the claims have gone through. There's a 90-day lag was there.
So September, October, November. So if we're saying August 2016,
Right.
and we need 90 days, does that mean it's reported in August, which means going back? So the month of August, then July,
Right.
and June, does that mean this is through June 30?
Yeah, Charlie asked a good question. And here's what our response has been. There's a claims lag, right? You can have the service delivered in August, and you don't have to submit the claim to get paid for it for 90 days. Okay, but what we've discovered is about 98% of them come in the first 30 days. So,
Especially primary care?
yeah, so we're willing to see a little error here to give people more timely data. Does that make sense?
Absolutely.
I mean, with 2% just, lagging out 60 to 90 days, it's not worth holding up the data to you guys.
What that means is people are submitting their claims electronically, and it's processed electronically.
Yes, right away. Okay, so any questions about coordinated care organizations? You only get this presentation once a year. So you're never allowed to ask any other questions at any point in time. You have any questions for Ken as a board member?
Ken, how come it's not fixed?
Or comments, Ken?
I really have no comments. I've actually missed the last several board meetings because of conflict scheduling. I will be at the next one.
So there, part of that $5 million though, there were some investments in data and technology to help our clinics identify patients who need these services. Last year, we invested in community health workers. I don't know, do we have any, Charlie?
We had two. One in community health workers and navigator. So we had a senior navigator position, and then we had a hospital navigator position.
Okay, so transitions in care. They would only be able to bill for the Medicaid services, but we have invested in a training program with Oregon State University to allow for distance learning to become a community health worker. If they're placed in public health or primary care or a hospital or the mental health agency, they can bill for their services. So part of that money that's held in reserve was for that. $1 million for a residency training program for family physicians because we need more docs out here, and issues related to loan repayment perhaps. And there was not a decision, Beth, on something that I talked to you about, but it was debated and can be brought back in, which was how do we recognize our partnerships with public health, especially when we know that there's an incentive measure sitting right there called immunizations that we're not doing in primary care. Most immunizations are occurring through public health. So what we were thinking about was a per member per month payment to our public health partners as we move forward. But we'll see what happens. I mean, I think it needs to happen. My boss thinks it needs to happen. Hospitals are scratching their heads as owners saying, what's public health got to do with this? And that's the truth. So, Ken, please.
I still have the same topic in the back of my mind that I've expressed several times. What we're trying to reach here are the CCO folks.
Yep.
Low income or poverty. Both of those terms are not, they have stigma to it. But those are the ones that are scratching for a living. How do we connect with them? Public outreach. And I haven't dealt a lot of time on that, but typically they will not be reading the newspaper. Typically they might be busy and not listening to radio. Radio could be one. But enhancing our outreach to that population that is there. And I go back to the blue, that's psychiatrists and everybody else.
The clinical advisory panel?
Yeah. Do they have ideas on how to reach that population?
Why isn't there an app? There should be a phone app that just sends them reminders when they need appointments.
Well, that sounds good, Beth, but you know, I think they said about 20% of those phone numbers don't work.
I know that's the thing, and they can change every few
All the
days.
time they're changing.
Yeah.
It's hard to do the outreach there. But again, if we were to invest in radio, it benefits everybody if the message is getting out there. But we also need for our clinicians to do outreach. And they don't have a lot of time, so some of our LCACs have said, just give us the names of the people who need a colon cancer screening. You let us use your letterhead. We'll provide the labor to send those letters out and make the follow-up phone calls the way the focus group suggested that it should happen.
Well, I have to say that the whole attitude towards public health is showing up because hospitals and people saying, what's public health got to do with it? We've always been preventative. Always, first and foremost, preventative services.
Right, population-based health.
And secondly, we've always dealt with the lower income population. So those two things,
Right, the home visiting
I don't
programs,
yeah,
health,
I don't understand why,
babies, cocoon.
where the attitude is that what's public health got to do with it? Because,
Maybe it's not what's public health got to do with it, it's let's keep the money. How about that?
well, I think you're talking
That's the
about,
honest
Yeah.
truth, yeah. But that is where low-income families go, because they know they
Oh.
can go there and get outreach, and
Yep.
that's always been their first contact.
I went to get my prescriptions this month, and the Oregon Prescription Assistant Program,
Yes,
it says present this to your pharmacist to save on your prescription. I presented it, and Howard's does not take it because Howard's has to pay money for each prescription they fill. I could not use it. They said throw it away.
for Medicare.
No, this is my prescription. Prescription D. I have Aetna as my insurance carrier, and I got this from the state of Oregon. And she actually said that Jeff has to pay it, so he will not accept it.
Yeah.
Don't know.
Yeah.
And that,
I think he has a choice.
I can look into that. I mean, we did change our pharmacy benefit to,
But are you a CCO member? Is that how you get your insurance or through Medicare?
no, she's Aetna.
I'm Medicare, and I get my prescription through Aetna.
Your Part D.
Right,
Yes.
that's not up.
Keep in mind that the program that we changed is specifically for the CCO patients. You're not a CCO patient.
Yeah.
Okay.
So you get it through a different insurance plan. So that might be something that
And my
Andrea
address for the rest for other people.
at the senior center might be able to help you.
Well, back to my question, how do we reach these folks? I heard that public health probably had the greatest connection with this group. How can we capitalize to enhance that outreach through public health to these folks?
I think the knowledge is around the table if we put our minds to it, but there isn't a straight answer for it, Jim.
So, I think Paul, I think that the concern that hospitals might have in wondering the role that public health has is that, remember, this is a claims-driven business.
Right.
And that public health has not had the ability to, because it doesn't track the immunizations through billing. It hasn't.
We track all the immunizations, we have a tracking program through Alert,
Right.
and then we do bill Medicaid, so that should be able to be tracked.
It should be, but it hasn't been working as well as it should. Otherwise, we would assume that all kids are getting their immunizations.
I just got this one. They're running rapid.
Excellent. I'm glad to know that.
We got some.
And
little
so this
glitches
one
we
probably
need to
won't
work
work
on.
either.
I don't know.
I'll find out, but you know,
The
people
tracking
below
working.
get these. You're exempt, and they pay out to get their medicines. We don't get that.
But we're billing, so that.
Speak for what Howard's does.
No, I don't.
I think that particular incentive measure is measured through Alert. It's not
Probably
based on.
Alert, and the
That's right.
other thing is the Vaccines for Children program, right there is, I mean, if you can't get any better data than that.
Right. Better move on, Arvind.
Thank you, Paul.
You bet.
Before I get into the CHIP updates, I just wanted to add, as a CHIP person, not only do I want to see the successful implementation of the strategic plan 2016-2019, but I also want to see Lakeview, Lake County to grow into a healthy community to develop as my own home. In the short time that I've been here, I've observed some amazing programs that have lost momentum because of some barriers in the form of miscommunication, misinformation, lack of coordination. And my aim is to try and remove these barriers so that Lake County can perform at par with the other counties. And as Mr. Paul McGinnis showed us the slide, we can see that Lake County is the only one which has 4 measures in the red. And I want the CHIP program to achieve a balance between attaining resources, funds, and utilizing and shaping the county to how the community or you guys want it to be. And and we can achieve a lot of good for the community with your support. And now coming to the CHIP updates, I'll talk about the oral health program updates and also the youth health advocates, as unfortunately Melinda and Jamie Davis couldn't be with us today. So coming to the oral health program, this is the 2nd year of funding for the oral health program. The service days have already started. The first service day we had was on September 28th at North Lake School, and thanks to Melinda Bentley, 44 kids were screened and received fluoride varnish. On October 24th to 25th, the service day will be at Paisley. the program will be returning back home at Lakeview on November 9th and 10th. But the screenings will be done during the parent-teacher conferences. And I guess due to some past issues, we have a special permission to carry out the screenings during the parent-teacher conferences, which actually isn't, thank you, Christine.
Sorry.
Which actually isn't very good for Lakeview, as numbers are not as good as for North Lake School or Paisley, as it's just a difficult process to get the screening done during the parent-teacher conferences. The next service day will be on December 9th at State Line Elementary, New Pine Creek. And no dates have been confirmed for Adel and Blush for the homeschool students through Lake County. And because of the transition from passive consent forms to active consent forms, I and Christy, the grant writer, we came to the conclusion to reduce the screening percentage from 90% to 60% because it's just more realistic then. Last year we screened 31% of students, and this year we're aiming to definitely exceed that number. Coming to the youth health advocate update, there was a meeting and training that was carried on August 12th in this conference room with the youth health advocates and the mentors, the program coordinator, the Oregon State University extension agent and a nutritionist carried on the meeting and the training. But since then, the program did not move forward because I guess there was no chip coordinator during those times. Well, I and Christy wanted to move ahead with the program, so on mid of September, we made an appointment with Jamie Davis, and we knew what to do to move ahead with the program. And with a lot of help from Rochelle Hansen, we could prepare the lessons in very short time. And Jamie Davis has provided us with the name badges and uniforms for the advocates, which will be sent out soon. I'm in talks with Mr. David Kerr and Mr. Jesse Hamilton, the principals of North Lake and Lakeview High School, middle schools. And anytime now, they'll be getting back to me with what dates and times would be appropriate to conduct the classes. And the program was, in the program, the plan was to teach from September to December, but we weren't able to conduct classes in September, so we'll have to make up for it during either in October, November, or December. We'll make up for an extra class that the advocates can teach.
And just as a reminder, that program was funded by the Transformation grant dollars. So now called the Transformation Community Benefit Initiative Reinvestment. And that's the $1 million one that's competitive. I don't know that you'll be able to have results that will allow you to continue that, given the timing when this next proposal is meant. But I do believe adolescent well visits was one of the things that they were targeting.
And they're doing $1 million grant or several?
No, they'll do
Yeah.
bunches of them.
We're hoping to get that full million, just so you know. If we could.
For the Women's Health Ambassador, we have an ambassador amongst us, Noni Moss. Could you give us an update on how your classes have been going?
So I took over for one of the original ambassadors, Monica Lawson, who had moved. Monica was stationed, or I guess based out of the senior center. So her classes were very successful. Several of the, not several, I'm sorry, I think it was two actually, right? Two of the ambassadors said that they were having a significant problem getting people to attend. Most of them are based out of the church groups, so the individual churches themselves, and they were kind of going off of that support base for the classes. Several of them are still continuing regular classes, having good connection with that. The idea was to have a group of up to about 12 where the women could freely talk, felt comfortable talking and sharing information. A lot of it is kind of personal. It digs into personal questions that are health concerns, should be health concerns that a lot of people don't want to discuss publicly. Monica's classes at the senior center were and continue to be fairly successful. It's a targeted group, targeted population, and it kept the attention of them. So for the ones that have participation, it's been going great. They are continuing through. We have 2 more months, this month and November. So I think we're planning to kind of do an end of year kind of thing in December and bring everybody together. But it's been extremely beneficial for those participating too. I mean, I would say highly successful for those that are participating and have actually chosen to continue the process.
Thank you, Noni. And there is another ambassador, her name is Anna Heflin, and her enthusiasm is infectious. And she was heartbroken that she couldn't make it for this meeting, but she told me to just play a 1-minute video during the CHIP meeting just to show how her classes are going, just to give an update.
Coming to you live from Newport, Oregon.
Can everybody hear that?
We'll be quiet.
Wanted to make you guys a quick video email because I couldn't be there on Thursday, and let you know that I love running my group. My group runs a little bit differently. We use online links to be able to click and connect in on our meetings when we need to be live. We also do live meetings where we can get together, and everybody who comes to my group gets a binder full of information. The information comes with calendars, with dates that we're meeting, the subjects we're talking about, and they have a little bit of homework to do, questions they can ask. We get together, go over everything, and then let the group run the meeting itself. So I also gather with women one-on-one, individually, group, as many times as needed during the month, so our group's a little bit different. I like to network with women, connect them, and help them however I can, financially, whatever it takes. So my group will be continuing after this group ends. I hope we get funded again. If we don't, I'm still going to continue because it's my passion to help people here in Lake County. Thank you for letting me be a part of it, and I will talk to you guys again soon.
Where is she physically?
Newport.
Oh, okay. I was going to say, that looked like the ocean.
Yeah, we don't have that
I
here.
don't think we
Well,
have.
that was on New Goose Lake.
Just haven't been out there recently.
The Hispanic population of ladies that Marissa's working with as an ambassador, they are really bummed that there's only a couple more meetings and they wanted to keep going, so.
They find it to be very helpful?
Yeah, she has 11 to 13 and they're consistent in coming out, yeah, and a lot of good topics. And so, yeah, they wanted it to continue. They thought it was a real good. And they're asking for handouts so they can bring them back to other ladies. So she's outreaching, yeah, more than that. So
Was there 12 original ambassadors, is that correct?
Yes.
I thought they were 11, yeah.
So there's really like 9 or 10 going strong.
That's excellent.
Yeah.
You mentioned that was coming to an end.
yeah, isn't it 2 more?
The funding.
Yeah.
Yeah.
Yes.
So there's 9 or 10 groups, or there's 9 or 10 people attending?
9 or 10 groups.
Do
Yeah.
you have any idea about how many there are in each group or total?
Yes.
Like Anna's group or the other group she was mentioning?
Around 4 to 5 groups have a turnout of 9 to 11 people, while the other groups have a problem with the attendance. While I guess 2 have stopped now because nobody was coming to the meetings.
But that's still good.
Yeah.
I mean, that's great. Good.
Coming to the food court program, this program started mid of this year, I guess. And we have a food court representative who has joined Lake Health last month. Rochelle Anson, can you give us some updates on those?
Yeah, sure. So I've been serving here in Lakeview for the past month and a half or so. So I'll just go into some quick updates of what I've been up to so far. So basically, again, Food Corps, the general mission of the program is just connecting kids to healthy food in schools. And Food Corps aims to do that in via three key areas. The first being hands-on learning, and then the second, healthy school meals, the third, school-wide cultural health. So I'll just quickly go into what I've been doing in terms of those three different key areas. For hands-on learning, that's probably been like the most progress that's been made so far. I've been teaching since the end of September. The last week of September, I started teaching in classes, both at AD Hay Fremont and then out at Union. And so I'm teaching in 7 different classes, grade levels K through 6, and they've all been half-hour lessons, and most of those are on a weekly basis, some of those are bi-weekly. So that's been going really well, and the kids have been really excited. We've been doing like a wide range of stuff, been working with like herbs a fair amount, using like 5 senses, like writing poems. We've been making lemonade, converting recipes, so getting some math in there. Just a wide range of things. And it's been pretty, I've gotten good feedback from teachers and from students, so that's been going well. In terms of the healthy school meals, that's been a little bit slower moving, but I did meet with the head cook out at Union this past week, and she's really receptive. She's already using actually the produce that's coming out of that garden that they currently have out at Union. So she's already using that produce. I think she made like some coleslaw this week from the cabbage they bought out there. And she's really open to us collaborating to conduct taste tests, which is a big part of Food Corps', how they like to approach cafeterias, just by getting student buy-in via taste tests and having kids rate how much they like the food, and just really trying to get kids trying new things. It's okay if you don't like it this time, you might next time. That's the sort of idea there. And then ideally I'd also be able to collaborate with the food service staff here in town at AD Hay Fremont as well, although I've yet to be able to sit down with them. Let's see.
All the schools are independent though, they don't have like a contract with Cisco or somebody like that, right?
I believe they are contracted.
Or Marriott or?
At least Union I know is Cisco and K&K. It's out of Altura, so they're more like local. But there is,
they still have
there is some wiggle room though in terms of modifying recipes. I know Union has like a scratch kitchen, and so they have all the equipment out there, and with like the head cooks, willingness to adopt healthier recipes and whatnot. That should be pretty promising. There's also there's been talk of, through the OSU extension, Jamie Davis, we have a meeting set up to collaborate with Klamath OSU extension office. They have SNAP Ed as a program out there in Klamath, which has been a program here in Lakeview but isn't currently, and so I think we're going to try to work together to implement some of those things here in Lakeview, since we are eligible this year in terms of like the free and reduced lunch percentage. So I think that a lot of SNAP Ed and they have this Food Heroes program, and so that's looking to get like outreach with families, encouraging healthy eating at home. But there's also a lot of different programs that can be implemented in cafeterias, like organ harvest for schools, and like farm to school type stuff. So definitely going to be looking to implement those programs as well in the future in the coming months. And then also there's been talk of salad bar grants, so trying to get some salad bars into the schools. Of course, needing admin support for that, but there has been talk of it. So I'd be really interested in trying to get some of those grants, since there aren't any salad bars in any of the schools at the moment.
With sneeze guards.
Yes, that's key. That's essential.
With the sneeze guards.
Sorry?
Who Who is making those grants?
So that no one's writing a current grant, there's just been like talk, it's been mentioned.
But who is it that's offering the grant?
The money.
Oh, sorry, there's a Let's Move grant, so like, it's like the Michelle Obama initiative, Let's Move, yeah, they have one, but they're like working, you know, with, I think like the Whole Kids Foundation is pretty involved with them, and yeah, so variety of organizations, but. Question?
No.
No, okay. And then just, yeah, the last part of just like the school-wide culture of health, just kind of like zooming out beyond the cafeteria and beyond the classroom. As Singh mentioned, I was, collaborating with the Youth Health Advocates Program. So we're gonna try to figure out how I can remain involved with them. I'm also attending garden committee meetings for the Union School Garden Project, which is slowly making progress. The greenhouse has finally the pieces have been delivered. I know there's some of them got lost in Summer Lake or something or other. But the ground is being prepped, and so hopefully construction of the greenhouse will be happening pretty shortly here. And yeah, there's just that farm to school grant from ODE that the greenhouse is being funded by, the project's being funded by. But there's also a lot of money for the schools in town, and so I was at the school staff meeting at ADA Fremont yesterday, and there was a big push from Susan Warner to start spending those funds because ODE requires adequate progress of those funds being spent, and none has been spent so far, and so I think really trying to vamp that up and get there's all these really cool resources into the classroom that hopefully I'll be able to help conducting lessons with all those things. And I think last thing is just that I'm also going to be trying to get out to Plush next week and start doing some lessons out there, probably on a bi-weekly basis. So trying to expand the scope a bit of what I'm doing outside of Lakeview.
Thank you, Rochelle.
Yeah, that's that.
Coming to the grants, Christy, can you
Yes. This week, we submitted proposals for 2 different programs. One is the 3rd year of funding for the school-based dental program, the 3rd and final year of funding, just so everyone knows. Because of the numbers that you guys saw on that slide, that 30% of kids got this training last year, we pitched to the grant makers that we'd like to have an increased emphasis on education. That's really what we're selling them on this year, that yes, we're going through the schools and trying to educate, but we're also going to try to do mailings to the families themselves so that we are kind of circumventing some of the schools, given the history and the conflict that has existed there. We're going to try to go directly to the schools, go to the school boards, make presentations so that any concerns that the schools have, we are right there to address issues. Try to use the media a little more, use the newspaper. We have money for advertising that we need to be spending, and try to get stories in too. I'm looking at you, Jimmy, stories. So that one, I'm wondering if Charlie knows when the money, if they cut us a check, it comes in late February, early March-ish, so I'm guessing we'll hear by the end of the year or so whether we got that grant. The second one, thank you for letting me know that you got it, was the Obi-Gobi grant. This is specifically for older adult behavioral health programs. And working with the Wellness Center, with the Senior Center, with Klamath and Lake County's Council on Aging, we pitched a gatekeeper program. Gatekeeper, traditionally, trainers come into banks, to grocery stores. They train businesses, things to be on the watch for. If grandma's in with her granddaughter, they open a joint checking account, and the granddaughter is taking all of the money out of it. The grocery store clerks know what to watch for, especially in small towns like ours, things that are older clients that are coming through that just seem a little off. The newspaper that I was at in Ontario, our carriers were all trained, so if the newspapers are stacking up outside Mrs. O'Leary's house, then they would make a phone call and someone would go and check on this. So our twist for Lake County, because our little individual communities have such strong identities, rather than doing a business-based approach, we want to go community by community. So Christmas Valley people are trained to watch out for Christmas Valley people. Paisley folks are trained to watch out for Paisley. And so we're going to try to have trainings in all of these different little communities. It's an opportunity for all of the different programs that are available to make people aware of all these things, to make them aware of transportation and all of the different services through the senior center, through the hospital, through the different primary care, through the behavioral health. We're just gonna pull as many partners as we can into these meetings to make sure that all of Lake County is aware of all of these services, and so that people who are already keeping an eye on their neighbors have a tool to, I see something wrong, now what do I do? So that's kind of the heart behind that, and we should find out November 30th, I think, is that, do you know? End of November, it's just when we're supposed to find out.
Yes, the field services team is the people who are gonna review it, because we're independent of that. But remind me, it was, Lake was grouped in to compete with Douglas, and what other town?
Don't know.
No, Klamath wasn't part of it.
I think it's just Lake and Douglas on this one.
Well, then you have a real good chance.
Thank you, Christine. So we have, I'm guessing most of you have these documents that shed light on the Eastern Oregon Healthy Living Alliance updates. And we have Alana, representative. Could you give us some updates on the Healthy Happy Smiles program?
Yeah, I'll just give you guys some quick numbers on our Healthy Happy Smiles program. So we kicked off this year, and right now we are in Harney County, Baker County, Grant County, and Malheur County. We're in a total of 24 schools. So 10 in Harney County. That's actually, there are 11 schools in Harney County with grades K through 8. The only reason we are not in all 11 of them is because there is one school, it's a rural school. The entire school makes up one family, and that family decided not to participate this year. So that's the reason we're not in all of them, but we're in 9 in Malheur, 2 in Baker, and 3 in Grant.
Is that a home school?
No, it's a one-room
Is it the
rural
double O?
schoolhouse. It was Diamond, actually.
Oh, okay.
Decided not to. I think they had 3 students this year, and they're all in the same family. So.
Well, and they may have already had sealants and have dental insurance.
Yeah, it's
and
possible,
meters.
yep. So, of our 24 schools, 14 have already received services. We have screened 731 students. 554 have received fluoride varnish. 80 have received sealants. There are a ton more sealant dates scheduled in Harney County because they screened and then she needed to set additional dates because so many kids need to be receiving those. And then we also purchased a hands-on dental health learning lab that we are taking to the schools. That's our education piece. I've taken it to 5 schools so far, reached about 1,100 students. I'm loving it, the kids are loving it. What we do is we go in, every student in the school goes through the lab regardless of whether or not they're receiving services, and then they all get sent home with a toothbrush. I think we're making an impact with it, I hope we are. I've had a couple of kids that really stand out. I had a student in 8th grade tell me she had never been to the dentist before. So I felt pretty good about reaching students like her. I had another boy, his eyes lit up when I told him he was going to go home with a toothbrush because he said, my parents don't make enough money, we don't have toothbrushes. So I think that we're making an impact.
Did you slip them an extra one?
I'm giving extras to every school. I give about 10 extra toothbrushes to every school and tell them distribute them as you want to because I know there are kids out there that don't have them. So that learning lab has been...
Is that the same thing with toothpaste?
Yep, they get a brush and paste. It's a little travel-sized paste, but at least they're getting something. So we're partnered with Advantage Dental on that. They've been awesome. Their hygienists are the ones providing the services in the schools for us. And then on your handout there's a little teeny tiny picture of some of the kids going through the lab, learning how to floss. So I'm having a lot of fun with that.
Thank you, Alana.
Thank you.
And with that, I guess I can wrap up the chip updates. Are there any questions? So let's start with the transportation. Andrea and Roman.
Well, we don't want to keep you too long, I recognize the time, but we have treats, so if you'll stay for just a second and listen to our spiel, Brian, for a minute. Noni has a brochure from the Navigator program, but we also have a piece of paper talking about public transit, and I wondered if I could just go over a couple of the highlights of this piece. So on the front, the page with the little tiny fuzz up in the corner, it's just some real basic stuff. If you or a friend or a neighbor would like to ride with us, some stuff we have to know. And then kind of a little bit of some of the structure about how we operate. So we have been providing transportation to Lake County since before I came into the picture, years. And with some really great funding from ODOT and from a VA grant that we've received, and some pretty good advertising with some fancy new vehicles, we're providing a lot more rides than we ever have before. So we're experiencing a little growing pains, if you can imagine. We're hiring for a driver position. If anyone knows of anyone who is a good quality driver. We're also looking for a transportation coordinator. We have that place just resigned this week. So we have a good base of people that we're transporting, but there's new people every day that are hearing about it through some of the advertising that we're doing. And anyway, just a couple of the highlights. So number one, we provide door-to-door service. So if you're calling for a friend or a neighbor, that means our driver would walk up to their door, meet them, and escort them to the door of the bus. Of course, get them all situated if they're in a wheelchair, or making sure their seatbelt's on. Drive them to a hospital, clinic, the grocery store, wherever they're going. Make sure they depart safely at the door of that business. And then they're free to move about the facility on their own. We had an ODOT audit recently, and we learned that we're doing all kinds of things right, but some of our drivers are just a little too kind. We don't have insurance that covers us to push them around in the grocery store. And if you read on here, we're paying our drivers. So we're trying to schedule trips, make things, good use of their time. So we'll get you there, you do the rest, kind of, that's sort of the gist there. But also, we're having more and more people that were driving. We're having a little bit of trouble with, we'll take you to a doctor's appointment, but then if you get a ride home with your sister, we don't necessarily know about that. So we have a driver waiting, and he didn't receive a phone call, and we're paying him to, so that kind of stuff. We just really, communication is key, and we're working in-house to communicate better, but we're just asking for the public to be aware of that too. But also one of the, number 6, if you need someone to travel with you, you need an attendant, you need a CNA, we have had a couple of situations come up. Please, please, please invite a friend to go with you to help you out with that, or, because that's not the role that our drivers play. And your friend or companion would ride for free. So get a free trip to Bend or wherever it is that you're going, Then the whole thing about we bundle our trips because we're trying to make good use of the funds that were granted, and that kind of all just sort of speaks for itself. On the, moving on to number 11 at the top of the back page, we're trying to shoot for a Tuesday, Thursday, Bend and Medford trips. And I hope you can help me prove a couple of the drivers wrong, but they say, clinics and hospitals won't work with you on that. But I think with enough advance notice, if everybody knows on Tuesday we go to Bend, I think we can rally the troops and we can, send a whole busload of people that are in need of services and really make good use of the funds. But a couple of people, I've got to work on that. But so if you know someone that's in need of an appointment, give them a heads up to talk with us and see what day we're going, so that we can make it easy on everybody. And of course, number 12, we're using our office number. So if you call the senior center, go through the prompts, look for the transportation number. And then
104.
Thank you, Noni. And that is the number you need to use. So the drivers have cell phones, but please, please, please don't try to make an appointment through the driver's cell phone because that doesn't always get translated back to the office to get on the schedule, blah, blah, blah. You can imagine how that might help. And then just some crazy things at the bottom of the page. I don't know if it's because we're a senior center and they aren't really sure. I'm having a tough time figuring out what the thought process is, but we get some really wacky questions. So, no, we cannot help you move. A gentleman actually was trying to get a doctor's appointment in Bend. He said, well, if you could just drop me off in the Pine, I have a house there. Spend a couple hours, that'd be really quick. And I'm just the generator and some things, you know, not too heavy. I bet the driver could lift it. He wanted us to transport his stuff back to Lakeview on the bus. No. And also, all these things, if you read through 1 through 9, have happened to us. So number 2, we can't go to Klamath Falls and let you load up pallets of stuff to transport back to sell in your private business. We can't do that, sorry. We can't take just a select group of individuals to a dinner party in Alturas or whatever you want to do. We can't do it. We're public transportation. So we want to say yes to many, many, many things, but these are just some top.
No alcohol on the bus.
Yeah, that one too. And holidays, we're closed. We would love to, you know, a group that needs someone from long-term care to show up on Christmas, and that'd be awesome, but, you know, at this point, that's not really what we do. And number 9, we've had a little bit of, you know, trouble with this. If you're released from the hospital in Bend and we're going to bring you all the way home, or even the hospital locally, but it's been some out-of-town kind of things, please, please, please make sure someone's there to greet you at home, meet you at home, because our driver will take you to the door. You know, some of it's common sense, but yeah. And also you can't pick and choose who your driver might be. But, so we are working really hard. I have a good staff of drivers, and of course with nice new vehicles, everybody's happy to drive. But give us a chance, give us a call, and we will work you into the schedule. We're doing the best we can, but there's a little bit of, you know, learning as we grow. And we have grown, we've tripled our trips, so that's awesome. That's true.
Andrea, do you pick up people in Paisley and bring them here for a visit, for a doctor visit?
Yes.
I was asked that recently, that's why I wondered.
We can, and we do. And going back to, I think it's like number 3 on the list, we had a situation recently where someone from Paisley was here and wanted us to transport them back. And we called and called and called, and without good contact information, that trip didn't happen. So, you know, we need to confirm if we're scheduling an hour up, an hour back, you know, that's kind of sort of roughly 3 hours for a driver. We need to know that that trip's really going to happen, so we're not paying him. And so, you know, if it's a cell phone or a home phone, we just need to contact stuff.
Do you have bilingual staff for the transportation?
We do not, but we have
An app.
We have an app, but we also have translation services that are available by phone for scheduling and that kind of thing. But I don't think we've ever run into an issue where somebody didn't have somebody with them that could, you know, translate or they were able to communicate with us.
Do you want a number 10?
No.
No, we do not give Paul a ride down and back on Thursday.
Well, for the right price.
We take donations, so.
It's not number 5.
Under
Doesn't
the
make any sense to me.
Please be healthy enough.
Oh, hi.
The little number.
Oh, under that.
Yeah.
Oh, so being public transportation, we, you know, if we can't pick and choose who we transport. So if you call and Christy calls, we need to take both. And we both have to ride in the same vehicle, but, you know, I mean, we had some silly stuff where, and we do a route kind of, Monday, Wednesday, Friday, and collecting people for lunch. And not everybody wants to ride together, but it's public transportation. If you think of like a shuttle or something in the Portland area, you wouldn't ask some of these questions, but anyway.
Right?
Okay, thank you.
So thank you, Andrea and Noni, and thank you all for attending the meeting. And I guess the meeting is adjourned.
The next meeting is Wednesday.